Good evening. My name is Godfrey Boyd, and I'm going to be presenting on patient with initials TW, female, 49-year-old Caucasian, and she lives in Denver, Colorado. Her reason for the visit to the clinic today is she came alone and she drove here, and she's a new patient visit. And her history of present illness is as follows. She's a 49-year-old female to adhere to established care at Evans Medical Center. This patient has a host of diagnoses related to neurological diagnoses. She is also a cancer patient. She had a PET tumor removed from her abdomen along with her appendix 2 years ago. She is receiving care at a clinic called Clinica. It's a clinic that takes care of people with little to no health insurance. Her primary care provider is Dr. K. However, she wants a new primary care provider because her goal is to get referrals when she needs for medical diagnoses, including cognitive therapy and speech therapy, particularly for dysphagia. The patient is not protected by the COVID-19 vaccine nor the flu vaccine. She has declined these up until now, and we don't see her changing her mind. The patient is seeing the following specialists: a doctor for heme-oncology, Rocky Mountain Cancer Center, another doctor for advanced neurology, and her next appointment is next month. She sees an OBGYN doctor for chronic ovarian cyst, and she gets ultrasounds monthly. She's also seeing a doctor at the Chiari Institute. That's a psychological institute. She's also seeing an infectious disease doctor at University of Colorado Health Sciences Center. She can't remember the name of the doctor. And she's seeing a physical therapist. The place is called Select Therapy, and it's for her vestibular imbalance. She's also seeing therapists for counseling depression, and she's rehab without walls for 1 year of PT and OT and speech. She does not have any allergies to medications. Her history, social history starts with, no, she smoked for 35 years. And she stopped in 2001. She does not use alcohol nor caffeine products. Her sexual orientation is heterosexual. Her highest education is master's. She's actually a clinical social worker before she took ill. Her family history is pretty benign. Her mother, she does not know the condition of her mother, but she does know her mother has severe dementia. Her father is alive and in his upper 70s and with no health problems that she knows of. Her grandfather died in his 70s and he died of colon cancer. The grandmother died of a brainstem infarct, and one of her other grandmothers, maternal grandmother, died of colon cancer. And her grandfather died of a heart attack at the age of 35. Right now she's on valacyclovir, 500 milligrams daily, and she takes that for flare-ups of in her groin area. She's taking cyclobenzaprine for her muscle, to relax her muscles. She had several diagnoses for her past medical history. She's been diagnosed with fibromyalgia and other hereditary and idiopathic neuropathies. Zoster with other complications. That's why she's on valcyclovir. She's diagnosed with carpal tunnel syndrome, bilateral upper limbs, chronic pain syndrome, neuralgia and neuritis unspecified, cervicalgia, cervical disc disorders, urge incontinence, dysphagia, pharyngeal phase, thrombocytopenia unspecified, major depressive disorder recurrent, intervertebral disc degeneration lumbar region, hemiplegia unspecified affecting right dominant side, unspecified ovarian cyst, and her review of systems. Generally, she looks like she lost weight and she admits to losing weight. She said she lost weight ever since she was diagnosed with that abdominal tumor and after the surgery. Her skin, she had skin breakdown on her back. She reports that. Eyes, she reports no vision problems. Lungs, denies any problem of shortness of breath, dyspnea, cough, or sputum production or wheezing. Heart, she does have an irregular heartbeat, and she has pain in her legs when she's walking. And she gets palpitations and swelling of the feet. Genital urinary, she reports urinary incontinence ever since 2018, and she also has urinary retention. Abdomen, denies anything. She does have a history of abdominal tumor though, and she had to have an appendectomy and the tumor removed. Breast, denies breast lumps, breast tenderness, or nipple discharge. Extremities, patient denies cyanosis, reports right-sided weakness to upper and lower extremities. Neurologic, patient denies dizziness, edema, headache, numbness. Tremors, reports a history of neurological deficits. Musculoskeletal, she reports gait changes and right-sided extremity weakness and joint pain, myalgias, scoliosis, trauma, and weakness. Psychiatric, she reports being diagnosed with anxiety and depression and insomnia and memory loss. She denies any allergy, immunologic. She denies any frequent infections, HIV or allergies or urticaria. Heme, lymphatic, she denies any abnormal bleeding, but she does report having idiopathic thrombocytopenia for the past 30 years. Endocrine, she denies excessive thirst, heat or cold. Vital signs are normal. She's 5'1", she weighs 103 pounds, her BMI is 19.52, blood pressure was 131/68, and her temperature was afebrile. Saturations were on room air were 97%, and her heart rate was 66. The physical exam was, we did a limited physical exam on this patient due to it being her first appointment here. General appearance, normal. Eyes, no problems. HEENT were clear. The neck, lungs, and cardiovascular were all good. Abdomen was soft and tender, no masses. Extremities, marked right-sided weakness to upper and lower extremities. She uses a quad cane to ambulate. Her skin is normal turgor and texture, and she has an appropriate effect psychologically and denies any suicidal tendencies. So our assessment and plan for this patient are to establish care for her. We're not going to draw labs today. We would have, but she had these labs recently drawn at her other clinic called Clinica. She will sign a release of information and bring the paperwork and all of her medical records with her to her next visit. Her follow-up visit will be in 2 weeks. We will discuss her referrals at this time and reviewing her history. Her depression PHQ-9 score was 18 today, but she denies any suicidal or homicidal tendencies, denies any medication treatment at this time for her depression. She's going to continue with therapists. We discuss worrisome signs and symptoms and when to speak to emergency care. For her dysphagia, she requested a speech therapy consult. We will address that at the next visit because we need her medical records to evaluate her. A zoster infection is reoccurring with symptoms, but she has no symptoms now. Takes valacyclovir, discuss worrisome signs and symptoms, and went to seek emergency care. Thrombocytopenia, continue to see the Rocky Mountain Cancer Center. And for a right-sided weakness, continue seeing her neurology and PT. Ovarian cyst, continue seeing OB as instructed. She will return to the clinic in 2 weeks for a follow-up, and we'll hopefully get her started on her referrals and establishing care and earning her trust. Thank you.